to certain parts of our lives, like our wedding day or prom or graduation or these big things, and then birth and postpartum. There's so much fear put around it that we don't have the opportunity to like really think about it in this way that's like, okay, this is exciting. This is one of the biggest moments of my life. This should be a wonderful experience. I've heard so many parents say that they just block out the postpartum period because it's so tough and you're so sleep deprived. It's just easier to block it out. And I think it's really sad that one of the biggest things we go through in life gets blocked out. So I like to try to help families through that so that it's an enjoyable time and not something. I think that there's a lot of members of the birth and postpartum team, you know, your birth team, your providers, nurses, midwives, doulas, OB, whoever you're delivering with, your partner, family and friends that are in the room. I know it's different with COVID, but all of those people make up your birth team. I think for a postpartum team, it's really good to create a postpartum plan and think about what you want that time to look like. And maybe you're going to set up a meal train, and the people who are dropping off meals are part of that postpartum team. If you have a doula who's providing postpartum support, a lactation educator, IBCLC, any kind of lactation specialist. I have a list of local to the Upper Valley resources. But if you are not in the Upper Valley and want a list of recommendations for services like that, feel free to message me. I think it's good to have that list ahead of time. That way, when you're kind of in the trenches of postpartum and you have a concern, you already know who to call, and that list is already there. You already have your support team established. So you're not scrambling through Google and trying to figure it out while you're holding your new baby and have another. Yeah, I think planning for postpartum is really big. The first thing as far as newborn care that I really wanted to get into is your baby's appearance. So I know some of you are in like a partner class with the birth center that I work with, and we kind of discussed this a little bit, but babies kind of have an interesting coloring when they're born. It takes a minute for their blood to kind of rush through their body and for them to pink up a little bit, which is completely normal. And I think a lot of people don't know that. So your baby might look a little blue in the beginning. Their head might be more of a cone shape. It can be even more of a cone shape if a vacuum assist is used and things like that. But these are all very normal. And I really want to like emphasize that if there is something that's a concern, you will know from your provider right away. They should also go over like jaundice. So if your baby's a little yellow, that can be normal in the beginning. Sometimes they just want you to breastfeed frequently to help wash that out of the infant system. But sometimes the baby needs to go under a special light. But usually, with most cases I've seen of jaundice, you're not expecting to stay longer in the hospital. Like I was a jaundice baby when I was born, and I went home right on time. My sister had a baby who was jaundice. A friend of mine had a baby who was jaundice. They all were able to go home. And then you just come in for a follow-up to make sure that those levels are returning to normal. There's a lot of little birthmarks on your baby when they're born. Like a stork bite is one that you might hear, and it's just kind of like a more red discoloration of the skin on their head, their neck. Those all typically go away. Hemangiomas are normal, which is like a collection of blood vessels that are raised on the skin. So it's like a red kind of puffy mark. It can be on their fingers. Some babies are born with them on their lip or their leg, their tongue. Usually they go away by age 2, but sometimes if they're larger and they look like they're causing discomfort, they're not painful, but if it's like one that's on the infant's lip and it's affecting feeding, they might choose to like do a medication. But all of these things are, I guess I don't like the word normal because I don't think there really is a normal, but common. So anything like that Vernix is the word for the white kind of creamy stuff that is on your baby when they are born. It's actually very good for your infant. And a lot of providers will say like it's better to rub into their skin, especially before their first bath. So in hospital settings, usually it's wiped off pretty quickly with a blanket. But I recommend rubbing it into their skin. It's been proven to help with skin issues long-term. Babies who delay their first bath and have the vernix rubbed into their skin are less likely to have skin issues like in their teen and adult years. So yeah, I have a photo I can show you guys kind of, but I don't know how easy it'll be to see. But this is vernix, this kind of white stuff on the baby. And then these are Mongolian spots on the baby's bottom, and it just looks like light bruising. That's less common and goes away within the first years. But if you think about it, like the way your baby's being born, there's a lot going on, and they're going through this canal that can kind of put them in some odd positions that are completely normal and natural with birth, but may leave some marks that, you know, might not be exactly what you're expecting. Let me show. So, you know, we got like the picture of a newborn baby who looks like this and is all peaceful and looks babyish, but usually they kind of have more of like a scrunched up face when they come out. So that's all completely normal. Going into umbilical cord care, so you can make the decision if you want to delay cord clamping. The reason people do this is so that all of the blood from the placenta and umbilical cord is going to the baby before. So delaying first bath. Some people delay this a week. I know people who have waited 2 weeks to bathe their baby. Some people just wait 24 hours and still want to do a bath within the first 24 hours. With their umbilical cord, once it's once it's cut and clamped, you need to do a sponge bath until the stump falls off. So you can also like just do more of like a wipe down kind of bath for them in the beginning. I'd say like in my opinion would be like I'd say like a 24-hour delay for me personally. Like that's what I would want to do. Not just because of the benefits of the vernix, but also because when your baby is first born, I think that birth is kind of one of the most traumatic things we go through as human beings, because we go from this very safe space where everything we need is right there into this bright world where we're like, what is going on? And this is all new. So I think in the beginning, I'm a big believer in like a safe and easy transition from womb to world. So keeping baby close to parents, on their chest where they can hear your heartbeat, and close to people who are familiar to them, I think is really important in the beginning. So that's more of why I would choose to delay a bath, but it's really kind of up to you what you're comfortable with. The other thing with bathing babies is, if you think about it, your baby's not a toddler who's like going and stomping in mud puddles. So they're not really doing anything that's getting them dirty besides dirty diapers. So there isn't a huge need to bathe your baby that often. Some people like it as part of the routine. It can be calming at night. It can help them sleep better, but your baby's not really dirty. So it's not like us where we need to like shower or bathe and like make sure we're clean for like hygiene purposes. It's more like something you can do with your infant. A lot of people include it in the bedtime routine because it's just, in the beginning, your baby doesn't do much in the beginning. your day is centered around caring for them, but there's not as many activities that you can do with your infant as there would be when your infant's like 9 months old and crawling and smiling and laughing and engaging more. So I think a lot of people like to include the bath in their routine because it's another thing you can do. So with the umbilical cord, usually there isn't really care needed. The stump should fall off in the first 2 to 3 weeks. Sorry about my barking dogs. But usually care isn't needed. If you have a concern, usually just reaching out to your pediatrician, they might recommend putting something on it, but usually it's just making sure the area stays clean. When you do a diaper change, the diaper, so some brands, Huggies, they are made where they have like a kind of cut down here so that it doesn't go over their belly button. But while the stump is still on, you should have it like folded down so their belly button isn't covered. But some diaper brands do already have it shaped that way. But that's with newborn diapers. And if you have a bigger baby, they might not be in newborn size diapers. So just making sure that it's folded down. It is okay for their like onesie and everything to cover the stump. Just the diaper should be folded down. Does anyone have questions about umbilical cord care or anything like that? Okay, so I have a diaper changing trick that I like to show all families because I think that blowouts are inevitable, but there's a way to make them a little bit less messy. Making sure your baby's diaper fits properly is really important. If it doesn't fit properly, if there's too much space, like if the back of the diaper is down too low, everything will go out of the back of the diaper. If you have a baby boy and their penis is not pointed down, its pee is going to go out of every part of the diaper. So making sure it's pointed down is important. But what I like to do when I change a diaper is, so I'll show you with a doll so that it's a little easier to see. But if, I don't know the best way to do this. So if you have your baby, you know, this is not how you'd be holding your baby with one hand, but if you have your baby on a changing table, say there's already a diaper on the baby. Before you even do anything to that diaper, unfold the new diaper and put it underneath on the changing table. That way, let me see if I can just tilt you guys down more. That way, when you remove this diaper and pull it out, clean it up, wrap it up and everything, this one is underneath the entire time. Because a lot of times what happens is while you're in that in between, your baby is going to either pee because they need to pee from contact with like cold air, or you know, just have incredible timing with when they decide to poop next. And then your changing table and everything is covered in poop and you have an even bigger mess. So I like to put the diaper underneath first just so it catches anything. You can get like changing table like pads that you can just take off, but then you have more laundry to do. And I think that this just works better. It also makes the diaper change quicker because it's already there. So you know, take a diaper off, remove it, roll it up and throw it away. And then all you have to do is secure the next diaper. The sticky parts are the back. So it goes underneath the baby. This part goes up over the top, and then these go like this. It is important to make sure these sticky parts are pulled out and stuck onto the diaper. You'd be surprised at how many people don't do that and leave their baby just in this and nothing is contained in there. So that's very important. The recommendation on diaper sizing is a lot of things, like even with infant clothes, it'll go by weight. It'll say like 8 to 13 pounds. If your baby's that size, it'll fit in this diaper or they'll fit in this outfit. That's not always true. Sometimes, you know, your baby, the way their weight is distributed is the same way it is with us. It's different for each baby. You might have a baby with super chunky thighs who needs a bigger diaper, but you might have a baby who has a big belly and then super skinny legs and needs a smaller size diaper. So making sure the diaper fits properly. You can always size up in a diaper and try it out. And if it's not the right size, then switch back to the smaller size and save those ones for when they are in the bigger size. There's no harm in just trying it out. I think with all of like newborn care, you know your baby better than anybody. Even if someone who comes in and is completely educated on newborn care, they don't know your baby. They know babies. They can teach you the basics of care, but you are the one that knows your baby the best, and can decide when changes like this need to be made. And it might seem like something small, but it can make all the difference. And I think in the postpartum period, things feel really intense. And no matter if you birthed your baby, you chose adoption, whatever your experience looks like, caring for a newborn and there's those first few weeks are intense. I think that's a fact that they're intense. Like there's no arguing with that. There's a lot going on. There's a lot of changes happening in your household. If you're returning to work, if your partner's returning to work, there's so many factors. And when all of that's going on, it's really easy for something as small as like the size of your infant's diaper to feel like a huge stress. Things feel a lot bigger than they actually are. And I think that's completely valid. And everyone's like feelings and worries are valid postpartum. But there's no harm in just, upping a diaper size, giving it a try. And if that's not the solution, trying something new. Some babies are masters at having blowouts and need an overnight diaper during the day or need a different brand of diaper, and that's normal. When your baby has a diaper rash, if it's just starting out and there's some redness, you could use like coconut oil or like even just a diaper cream, depending on what you're comfortable using on your infant skin, to prevent it from getting any worse. If it's getting bad, one of the things I recommend is letting your baby's bottom kind of dry out. So laying a towel on the floor and letting your baby go diaperless for part of the day, that can help. Frequent diaper changes so that they're not in a wet or poopy diaper too long. If it's starting to look like there's dots, little white dots, and bumps on the diaper rash, it can be a yeast infection. So usually in that instance, you should contact your pediatrician. There's no harm in having them just take a look. I think that if you have any concern with your infant, usually, I think right now most doctors, if not all, have the ability to like have an online portal or somewhere you can just ask a question. I think there's no harm in just like messaging and saying, hey, I think my baby might have a diaper rash, and describing what it looks like. And if they say, oh no, that's like not a big deal, just use an over-the-counter cream, there you go. But if you, but maybe it is something worse and you need a prescription. Usually they do nystatin cream, which is just like a yeast infection cream that goes on your infant, and it's usually cleared up within a few days, and it's not like a big process. But I think there's no harm in just, asking a question. I think.
Yes. I just want to interrupt and say that Hillary's given a good tip and mentioned that she's used cornstarch before diaper cream to help the drying process. And that has reminded me that I also just wanted to take a look around and take a little inventory. Can you raise your hand if this is, if you are pregnant and expecting your first child? Is there like a bunch of you here? Nice. Okay. Now, nice, Megan. Now the other guys, now raise your hand if you're a veteran and your baby's out and you're in the trenches and you've got tips. I know some of you guys here have. Nice, great. Okay. I love that you're all here, and I want to echo Jess's piece of the village, and leaning on other parents as support systems. Social connectedness is really important through parenting, especially when you are first having a baby and you're like, where's the manual? Okay. Oh, and I wanted to ask Jess too, do you have anything to say or add about cloth diapers as well?
That's one of the things I wanted to ask. Is anyone here
Okay.
planning on cloth diapering? Yay.
Okay, cool.
Love cloth diapering. I won't get too much into it since you're the only ones, but if you guys want to like reach out with any questions, feel free to. I'm a big fan of diaper pre-folds, not inserts that go in the cover, because the nice thing about a pre-fold is you put it on your baby. There's these things called snappies that connect it, and then you put a cover over. And usually if your infant has a dirty diaper, all you have to do is change the pre-fold and not the cover. Usually that cover can get you through the whole day, versus the inserts that go inside of the cover. Then you're changing the cover and the insert, like the whole entire diaper each time. So I think to reduce laundry, using pre-folds is the way to go. Have a wet bag that you take with you out and about to toss it in. Some people struggle with cloth diapering at night. Don't feel bad if you have to use disposables. A lot of babies soak through a cloth diaper at night, and it's something people are still trying to kind of find the solution for, because the solution is kind of just change your baby's diaper constantly throughout the night. But if your baby's sleeping through the night, you don't really want to set an alarm and disrupt your sleep and their sleep to constantly change diapers. So don't feel bad if you do a disposable at night. When your baby, so one of the things I was actually going to get into next is poop progression. So your baby's poop is very different in the beginning. Just in the first few days compared to the first week. It's also very different the first week compared to when your infant starts solids. So an infant who is on formula has different poop than an infant who is breastfed, but they're very different than a poop that you'd have if you start solids. So a infant poop is more like runny. Usually breastfed babies in the beginning have like a yellow, in like the first week have a yellow kind of mustardy colored poop. It looks seedy. But then when they start solids, it's more like actual poop. The tip I have for cloth diapering with that is, someone once told me, a lot of people become discouraged about cloth diapering when their infant starts solids because it's just messier and it's not as fun going and soaking that type of poopy diaper. There is like an attachment you can get for your toilet, and you can like spray the diaper down into the toilet. But someone once told me you can get organic like bamboo paper towels and lay a paper towel in the diaper. That way when they, over the pre-fold, that way when they poop, all you have to do is throw that away and it's all contained in there. If there's stains on the pre-folds, usually letting them sit out in the sun after they're cleaned, the sun like naturally bleaches them back to white. People have like sworn by that. So yeah, but if you want to avoid lots of stains on your cloth diapers, the paper towel trick is the way to go. And I think always just having a couple disposables when you're out and about, better safe than sorry. I was going to say you can never be over prepared. I mean, you can in a way, like you don't need to bring like your entire nursery in a diaper bag, but just have, 2 disposable diapers on hand just in case, because you never know. You'll think that you're all prepared, ready to go, extra outfits, and then your baby's going to be like, oh, now's the day that I've chosen to have 5 poopy diapers in a row. Surprise. When you're out and about and you think you have it all figured out. I feel like with infants, you think you have them figured out. It's like, okay, we got this down. Everything's going well. And then the next day they're like, time to switch it up on you. They like to give you a challenge, but you should take it a day at a time. And yeah. I don't know if it'll let me screen share, but I wanted to show what the poop progression looks like. If it won't, I can just describe the coloring to you.
This is your life now, guys. This is the glorious lifestyle
Yes,
that you signed up for. Jess, if you also want to send me an attachment through an email, and I can certainly pull it up for you if you'd like. I think you should be able to share your screen though.
It's not showing me an option to share my screen, but I am sending you this.
Great.
Right now, and if you just want to scroll down to the image that's in this PDF.
I can't wait. Thanks.
It's not real poop. I'm not showing you guys.
You gotta laugh about it.
The number of times that I have Googled baby poop coloring, probably about 1 million.
Yep. I've had to, oh yeah, I feel like that's part of the reason I also think that like new parent education is so important, is because you can find what you're looking for on Google, but you might find a whole bunch of other scary stuff too. So I feel like just, avoiding Google is good, having your birth and postpartum team so you can, yes, don't Google as a new parent. It's, you go in with a question like, is this normal? And you're going to end up with a whole forum of people talking about their concerns. I think it's good to have a group of moms, dads, and just parents that you trust and can like lean on for support. But sometimes those Facebook parent groups, you're going to get 300 comments that all have a different answer and confuse you even more than you were when you initially asked the question. So in the beginning, babies have meconium, which is a black kind of color. It's kind of tar-like. Then it goes to more of a green and then to the yellow. As it's the green is kind of in between, switching from the meconium, more black poop, into the yellow seedy poop. It can be more brown or orange if you're formula feeding your baby. Formula fed babies have smellier poops, which is normal, but if you like switch from breastfeeding to formula and notice a change like that, that's normal. White, I've never once seen an infant have white poop, and as it says, that is a medical concern, and contact your provider. Red can be, contact your provider if their poop is red, but it can be a combination of things. It's interesting because, so breast milk, you'll notice different colors of your breast milk. In the beginning, it's more of like a yellow, and it's colostrum, and it's high in all these antibodies that are great for the baby. And then it kind of goes to like more of like a milky white color. But if you eat beets, it can turn pink. If you eat greens, it can turn green. So you can turn blue. You can have like a whole spectrum of colors of breast milk. And sometimes that just makes your baby's poop look funny. But I mean, I think usually if it's, you can tell if it's like, oh, my baby's poop is a little bit of a different color versus like, oh, there is blood in my infant's poop. And there's a lot of explanations as to why that could be. If your baby has like a super bad diaper rash and their skin is cracking and it's like severe, then that may be causing like blood in the diaper. But even in that instance, you would be contacting your provider anyways. So if there's any redness, I don't even think I would wait I wouldn't go to the emergency room. I wouldn't wait to send like a portal message. I would call your pediatrician and talk to a nurse or the after hours nurse, because they'll kind of gauge what you should do. Yeah. And then I think if you scroll down, there should be the size of a newborn stomach. A little bit more. Okay. So with feeding your infant, I think a lot of people in the very beginning fear that they have a low milk supply, because you see people online who are pumping like 10 ounces of milk every time they sit down to pump. And that's amazing and great for them, but that's not what you need to provide your baby with enough milk. In the beginning, it's colostrum. They don't need as much. And it's not really, your milk hasn't really come in yet, but this just shows the size of a newborn stomach. So in the beginning, it's only the size of a cherry. day 3, size of a walnut, 1 week size of an apricot, and then at a month, a large egg. But it's very small in the beginning. And there's some lactation consultants who will have like, there's like this thing that they'll carry around that's a string of beads, and it shows each like day how big their stomach is. So if it seems like they're not eating a lot in the beginning, they're eating frequently, but not a lot at each feeding. That's normal. Their stomach can't hold very much. So they shouldn't be drinking 4 ounces the first day they're born in one feeding. It's normal for them to spread those feedings out. Breastfed babies, it can be normal for them to have less poopy diapers a day. Like 1 poop is normal, but it can also be very common that they have a lot of poopy diapers because breastfed babies, usually breast milk goes straight through them. So with tracking input and output with your infant, it's important to track wet diapers. I think it's harder to track output or input amount with poopy diapers because with breastfed babies, like we can talk about the normal amount of poopy diapers in a day, but the thing with breastfed babies is it's kind of hard to track poopy diapers because they can poop like the smallest amount, and you'll change their diaper and there's just like a little orange streak and you're like, okay, they pooped a little bit, but it's not, is that enough to count it? I count any diaper that has any poop in it as a poopy diaper, but the amount can be different with breastfed babies. But I like to show this image because I think that a lot of people feel like their baby isn't getting enough milk, and this just shows they are. They just don't need as much as we think they do that first day, and their stomach's small. Does anyone have any questions about? Yes. If you go see a lactation consultant, they'll have a scale and they will weigh your baby at the beginning. You'll feed your baby and then they'll weigh your baby again. And you can see how much they got. It's not completely accurate, but it's the closest we can get to see how much milk they're getting. If you're one of the moms and dads on here that are delivering with the birth center, we always bring scales to our postpartum visits, and we can always do one of those while we are in your home. So the other thing I want to go over, I'll pull this up on my screen if you want to stop the screen share. And then, so I think you're gonna get more when you pump with an electric pump. I think manual pumps are good to have if who, like, I guess in an instance where like you're going somewhere, if you're going somewhere and you can't bring your electric pump, but you're worried that like you might need to pump while you're out, not necessarily to keep your supply up, but for your comfort, I think it can be good to have the manual pump because you can get engorged and just need to relieve some of that. The Haka is a tool. Does everyone know what the Haka is? Raise your hand if you don't. Okay.
I can grab mine.
I got it.
Okay.
That one. So this is the Haka. So I don't even know how to describe it, but it's basically this like amazing device that catches your milk. If you have a quick letdown, it suctions onto your breast. So if you're breastfeeding on one side, it'll collect all of the letdown on the other side. Some people only get a little bit, only an ounce. I mean, one of the moms I'm working with right now, she'll breastfeed on one side and then on the other side get like 4 ounces just from putting this on. And all you do is suction it on and leave it there. I recommend, they make like a stopper that you can put in it, but my recommendation is, I know so many people who have these and set them on like their bedside table, it gets knocked down. Leave a mug on your bedside table, stick it in the mug, and that'll hold it like upright. So many people knock them down and you know, your liquid gold is now spilled. They say don't cry over spilled milk, but I think it's fair to cry over spilled breast milk. But yeah, these are great. It's like an extra, I think like $5 to get the stopper. I don't think it's worth it. I think just keep a mug.
They also make ones that have covers now.
Oh,
like the Gen 3 maybe. You can get them on Amazon, and Haka also, I should actually have mine tomorrow, which I'm super excited about. They make a silicone, it's like a necklace. One end goes, sorry, my toddler's in the background. One end goes around the neck of the Haka and the other end goes around the mom's neck to prevent, if it does come unsuctioned, it prevents it from tipping over and spilling like all over your bed or all over your couch or something like that. I've also used my Haka to help get out clogged ducts. You can fill it with warm water and Epsom salt and suction it on, and it will help pull the clog out. I've used that many times. So it's a very multi-friendly, multi-use tool.
That's really great. I like what you said about the clogged duct, because I think a lot of like people assume if they have a clogged duct that they should massage behind it to like push the clogged duct out, when really what you need to do is clear in front of it. And that's what the Haka would be doing in that instance. So that's really, really smart tip. Thanks for sharing that. But yeah, I think if I were deciding between a manual and an electric pump, I would do electric. I would get a Haka. Insurance usually covers a breast pump, but most of them do now. I really like the Spectra, but if you're in a situation where your insurance isn't covering one or you don't have insurance, I am a big believer in like reaching out to the community. Usually there's a provider in the area that is like has some connection and will help you get a breast pump. Right now the like no-show breast pumps are kind of in, like the Willow and the, oh my goodness, what's it called?
LV.
That's what it was. I was like, it starts with an E. The family I work with last night has it. Yeah, so Sarah said like even if you don't have insurance, like through WIC, you can get a breast pump. So they're pretty accessible to get an electric breast pump. I like the Spectra, but a lot of people have been using the Willow and the LV now. I've heard really great things about the LV. I think the way they're marketed is kind of as like you can use them at work and have them be less disruptive. I don't think they're really as much of that as they kind of market it as, just because you can tell when someone has one on, and they still make noise. But I think they're great to have, like they're smaller, they're more compact. I know people who like have a long commute to work and they pump while they're driving, and it works. Like the person next to you driving isn't paying attention to what you're doing and they can't even see it. While the other pumps usually, like, you can't really put on an electric pump and like have it be discreet with the way they're shaped, because you can just tell that someone's pumping. I mean, there's a bottle attached to them, you can see it, but the LV is nice because it can go like, and the Willow can go like inside of like a sports bra, and you can just put it on during your drive. Just make sure you have a place you're going to store the milk wherever you're going, or a cooler with you. Milk is good on the counter. So immediately, like after pumping, you'll hear a range, 4 to 6 hours. You can tell if milk has gone bad. It will have a smell. With breast milk, the fat will separate, but if it's bad, it's like spoiled milk. So you will be able to tell. But it's good for 4 to 6 hours on the counter, 4 to 6 days in the fridge, 4 to 6 months in the freezer, but a year in a deep freezer. Once it's been thawed out, you can't freeze it again. And once you've heated up milk once, you're not supposed to heat it up again. The main concern is just that there's less nutrients. Once you've started a feeding, so once your infant has come in contact with the nipple attached to the bottle, you should dispose of the milk within 2 hours from the start time of that feeding. With formula, it's within an hour. The concern is bacteria growth. So if you are going to use milk that was on the counter and say it's good on the counter 4 to 6 hours, you could pour some of it into a bottle, give it to your infant, and then if they need more, have the other milk right there to add to the bottle. That way you're not disposing of a large amount of milk if your infant doesn't drink it all. Because I know with a lot of people, breast milk is liquid gold, and in the beginning when you're establishing your supply and beginning pumping, the whole process, dumping an ounce down the drain is a very sad feeling. So you can always just.
Jess, I'm going to write this in the chat because I feel like a lot of people are taking notes. So I have 4 to 6 hours on the counter, 4 to 6 hours in the fridge.
I also wanted to send my like postpartum and newborn care guide to all of you. It has all of this in it if you want to refer back to it. So I'll email that over to all of you after. Because I know that like this, I feel like birth, postpartum, infants, pregnancy, all of it is just like, here's so much information thrown at you. Go have fun with that now. And it's like,
and be sleep deprived and try to remember everything that was told to you before you had a baby.
One of my favorite things to do for families is like I give out a baby-led feeding guide, and it has like the sizes of how you should cut up food, and it's a magnet. I think that, and then some places have the magnet with like the breast milk guidelines or even formula guidelines. Put that on your fridge. It's right there for you to look at. Get the most simple one that just says like 4 to 6 hours and like has the basic information, because you're not going to want to read a novel of all of the breastfeeding guidelines. Keep it simple, something easy to just refer back to. Yes. So that's another Upper Valley location. Anyone that's in the Monadnock region is delivering with the birth center, always feel free to reach out to me and I can get you one of those magnets and have that for you. Yeah. Okay, so does anyone have any questions about milk guidelines? I can go more into formula if that's necessary for anybody. Just give a little like wave if you want more information. All right. Usually, whatever formula you go with will have information. It's usually 1 scoop to 2 ounces, but the information will be on the back of the package of like how to make it. Some people prepare it at the beginning of the day and have it's good for 24 hours in the fridge, so have all your bottles like prepped for the day. If your baby's a clock baby and you kind of know at that point what their feeding schedule is like, you can do the same thing with breast milk though. Pull a bag out of the, if you have it in the freezer, pull a couple bags out, however much you think you're going to need the night before, thaw it out in the fridge overnight, good for the morning, and you can prep all your bottles if you wanted to, or you can just have it ready to go to pour into a bottle. Bottle sterilization is something that like a lot of people kind of have mixed opinions on. Some people are really big on like every time you use a bottle, sterilize it. Right now, the guideline is pretty much if your water coming out of your sink is safe to drink, then it is safe to wash the bottle with. Some people will sterilize everything at the end of the day. Some people do it at the end of the week. I think that it really depends on your water supply and what you're comfortable with. If you have a baby who has thrush, then, which is a bacterial infection in their throat, and it can, mothers can get it as well on their breast. But if they have thrush, there's like more of a push to wash and sterilize things more. So some people, I think that each family, you can be the most laid back parent in the world and think you have it all down, but everyone picks one thing that they are just a little more stressed about than anything else, whether it's sleep, feeding, cleaning bottles. If your thing is the bottles and you want to sterilize them all the time, go for it. But I don't want anyone to feel like they have to be like sanitizing and sterilizing everything perfectly. I don't think that's necessary. The families I work nights with, we usually do like at the end of like every other night, I'll just go ahead and toss in all of their bottle parts, and like they have a sterilizer, just because I don't know when they sterilize things. I'm usually the only one that does it. So I'll just like go ahead and toss them all in. Some people boil their bottle and pump parts. There's like little things you can get that go in the microwave where it's like you put in like an ounce or 2 of water in it, put all the parts in and put it in the microwave, and it like steams it. So there's a lot of different ways to do it, but I think, if you're using a good soap and you have a good water supply, that I wouldn't feel too pressured to sterilize super often. Some people don't wash their like bottle and pump parts immediately after the use, what they'll do is they'll put them in the fridge in like a bag or in a container, because they still have like some milk on them, so that they're not like sitting out on the counter with milk, and they'll keep them in the fridge and then take them all out at the end of the day and wash them all. Some people have like a wash basin that they set in their sink, and they fill it with like soapy water, and then you rinse a bottle and stick it in there, and it can just soak in there until you're ready to clean it. So there's a lot of different.
It looks like Megan has something to show us. Megan, do you have something that you want to recommend? Ooh, the Medela Quick Clean.
Swears by is the Medela Quick Clean steam bags. You can get like 20 uses out of each bag, and it comes with like 5 bags in a pack. You just throw them in the microwave.
Yeah, you put like I think it's like an ounce or 2 of water in there, as many parts as will fit, and then there's like on the back of the bag it's like 1 through 20, and you just cross off time you use it. And yeah, I think they're great because you can just put it in the microwave and not really have to think about it. Boiling parts works too, but I think there's some more convenient ways to do things where you're not having to like give it your full focus. So yeah, I think that's a great recommendation, Megan. Okay, does anyone have any questions about like bottle pump parts, feeding, anything? All right. The next thing I want to get into is, we'll kind of get into, is some sleep related stuff, calming and soothing your baby. On Thursday, I'm really going to get into sleep. That is my main focus. The families, so my specialty is overnight newborn care. I don't do cried out. I don't do anything like that. I do sleep coaching, sleep consultations, but what that entails is getting your baby on a schedule that works for your family and your infant, for the best development for them and for you. I think that it is not practical to function on no sleep. It increases your chances of postpartum mood disorders. It puts a huge strain on your relationship. It makes everything feels more intense when you're tired. You can't function on no sleep, and your brain starts to rewire to think you're getting enough sleep. So when you're postpartum, when you're like 2 weeks postpartum, you get a 4-hour stretch of sleep and your body's like, that felt great. I'm good to go for the day. Like that felt amazing. And really you're not, but compared to what you were experiencing at the beginning of those 2 weeks, it feels a lot better. When your infant first comes home, they're super sleepy and they sleep 18 to 20 hours a day. So they spend most of the day just sleeping. And then they wake up. And so in the beginning, it can feel easy. It can feel like, oh, great. This isn't as hard as I was expecting. The baby just sleeps all day and doesn't need very much. And then they wake up and they're like, wait, I'm no longer in the womb. Where am I? What is a ceiling fan? What is a tree? I want to look at everything. I've never seen these things. This world looks insane. Like there's so many distractions. So I am a big believer in the 5 S's, which is, so Dr. Harvey Karp's 5 S's. I had them written down. I'm probably gonna blank on one. Sucking, so pacifier. Shushing, so white noise. Families I work with always think I'm shushing them. I'm not. I just walk around and hold the baby and go shh, and they always think I'm like telling them to be quiet. No, I'm not. I'm just, babies, it really relaxes them. A swaying motion. That's the one S that I'm not like super into. I have never rocked a baby like this before. It has never gotten a baby to calm down for me. I bounce babies. I do, like, if you think about it, when the baby's in your womb and you're pregnant, when is your baby the least active? When you're walking around all day. When you lay down to go to sleep, your baby starts kicking and moving around and keeping you up all night. When you're walking around, you got this little like bounce in your step and it's rocking them to sleep. They can hear your blood flow. They can hear your heartbeat. They can hear a shh, a white noise. And then swaddle and I'm forgetting one. I have to look at my list. I always blank on the last S. Side hold. So I guess side and sway are the two that aren't like big. I'm going to use this kind of creepy looking realistic baby doll to show you. So the football hold is one that you'll hear of a lot. It's kind of like this, and I'm not talking about like the breastfeeding position, like but it's kind of known to like immediately get a baby to calm down. But it's where you have so you're supporting their head by holding them. It's a lovely creepy doll. And then the baby's legs are kind of on each side and they're on their belly. This is like a great way. Just hold them like this. It usually is if your baby's just like crying and inconsolable, if you put them in that position, it like instantly gets them to stop. I think this is the magic baby hold. I haven't had to use it often, but this like side position hasn't done any like wonders for me. I think holding a baby like this and patting their bottom and kind of doing a bouncing motion works, or holding them to the side this way where they're facing you, hand on the butt, patting and bouncing. This is also really great when you go to transfer them to the crib, because what you can do is go from this to this to this, set them in the crib, remove the hand that's under their head, put it on their chest and pat, remove the hand from their bottom, wait for their legs to go down flat. Because what happens is when we just take a baby and we're just like, boop, you're in the crib now, a lot of times their legs are bent and they get like, they have this startle reflex and they're like uncomfortable and weirded out by the position you put them in. And they're like, what just happened? I went from like this really safe, secure spot where I have everything I needed and I was comfortable to like just sat on a flat space. I mean, Hillary's doing the bounce right now. That's exactly it. That's the exact motion. It's really calming to them. So those are the 5 S's. I think that it's a huge part of like the transition from womb to world. They're all snug in their womb. They have the white noise built in from your body. They have everything they need right there. So I think the 5 S's really help with that transition. When it comes to swaddling, I have a couple favorites for the Velcro ones. And I kind of have different instances when I'll use them. So there's a lot of different sleep tools out there. This is the Merlin Sleep Suit. It has never worked on a baby I've worked with, but people like it. It reminds me of the Michelin Man. It's like they're in like this puffy little suit and they're just laying. So if you have a baby who really likes to have their arms out, that can be great. I find that babies seem like they don't want their arms out, and then you get them swaddled and they totally do. I like the Halo swaddle. It's got this zip up pouch. You usually, now they make it where there's a zipper at the top and the bottom, which is great. This one only has the one at the bottom, but that's also great because you can unzip the bottom half and change their diaper without fully taking them out of it. So you don't have to completely disrupt sleep, but it unzips. Baby goes in with their arms out, and then it's got this like Velcro piece here. So I'll show you guys with this doll what it looks like. A lot of them are very similar to this. There's the Swaddle Me, which is a very common brand. It is my least favorite. It is the most common swaddle you will see. It is like a little Velcro potato sack. I have only worked with one baby in my 8 years of being with infants that it worked with. It just hasn't, I don't know what it is about it. I like the Halo. And I feel like once you find what works, you kind of just stick with that. But basically, this is not how you would be holding your baby, but I'm showing you this way so I can demonstrate. So you have this piece, arm down, you have this arm down, kind of wrap it around them so it's holding their arms down. And then you have the other side and it goes around and Velcros. So you have your little potato baby. I like this because it's more of like a sleep sack. So when they are rolling over, they can't have their arms down like this. It's not safe. So a lot of people recommend transitioning out of the swaddle by 8 weeks to avoid having to do like a rough transition as soon as they're rolling over, but really by 12 weeks. The nice thing about this is you can use the Velcro and just have their arms out. So I feel like the Halo is great for transitioning because you don't have to switch them to something completely new. You just kind of change up the way you're doing it, but it would look like this. Someone said they use the Love to Dream. Is that the one that has like the flying squirrel?
Yeah, I'd show you, it's in the dryer because he spit up all over it. But basically it has their arms go in these like mittens, and it keeps their arms up like this, and it's tight on their torso and on their arms, but their legs, similar to the Halo, there's room in the legs. Both my kids hated having their arms down by their sides. So the Love to Dream was great because they could still be in, a tighter sleep sack, but their arms could be up by their face. And they also, Love to Dream also makes the same type of thing, but then the arms zip off. So you can zip off one sleeve and help with the transition, and then eventually zip off both sleeves. And then it's just a regular sleep sack.
Yeah. So I have heard really great things about that. For babies who like their arms out. The babies I've worked with have liked their arms in, but everyone I know who had a baby who wants their arms up did great with that one. I forced my mom to become a postpartum doula, and she's visiting and working with a family in Vermont right now, but she, the baby she's working with, they used that one, and it made all the difference with how long he could go in between feedings at night. My absolute favorite is the nested bean. It's worked really well for babies who like to be held. This is the sleep sack. So, same thing where their arms are out, and then it's just a zip up sack. But this part's a little weighted, nested bean, and it just feels like they have a light hand on their chest. And I was working with a baby who was in the Ollie swaddle. The Ollie is one that's like approved by physical therapists. It's designed to not go up over their shoulders. It pushes on certain points on the body to relax the baby and help them sleep better. She was doing great in that. The minute we switched her to the nest, she went through like a screaming week where like she would just wake up and scream, and not like scream like something was wrong, but just like she enjoyed making this screaming sound. And it was kind of like, we were all just like, okay, we just got to figure out what her thing is, what she needs. Because for me, I wasn't with the babies all day. I come in at night and I have slept all day and I feel ready to go. These parents were at their like wits end. They were like, she just has been screaming all day long. And it really was getting stressful for them. I gave them my other nested bean swaddle, not the sleep sack, but the swaddle. She's now sleeping through the night. She's 5 weeks old. It was her thing. It was what she needed. And I think that like, that's the whole thing with sleep coaching, is it's not leaving your baby in a room to cry, or, I mean, I know people who have done cry it out, and it's not like you're abandoning your baby and just locking them in a room and ignoring them, but it's hard to listen to your baby cry, and it doesn't have to be that way for you to get good sleep and for your infant to get good sleep. I think a lot of times it's just troubleshooting and figuring out what works for them, and using your intuition to figure out like what your baby needs. The nested bean also makes this one, which is another swaddle. It also has the arms that zip off. So these are kind of like nubs that, so they can either have their arms strapped down with the Velcro part, or you can have them up or just kind of like out in there, or you can zip these off and take their arms out to help transition. And you can do one arm at a time, like Hillary was saying. So a lot of swaddles have like the ability to do things like that, because it can be such a big transition, going from being swaddled for those first 8 weeks to being like, okay, now we have to get you out of this completely, and go cold turkey. And it can be tough. So usually they're made with, we see that. So the Love to Dream, Halo, Nested Bean, and sometimes the Ollie are my favorites, but all for different reasons. So, the Love to Dream, if your baby likes their arms up. The Halo, I feel like, is good for like textbook babies that just, swaddle, easy transition out of it. The Nested Bean is great for babies that like to be held. And the Ollie is, I don't know, I think more similar to like the textbook baby. It's one that has worked well for babies that kind of, textbook babies that just kind of follow our what to expect and kind of go with the flow. I am going to show how to do a swaddle with a muslin. if you have muslin blankets, you know they're huge. They look ginormous. You're not swaddling your baby like this though. You're taking it and folding a corner down so you have it in this like triangle shape. If you can see that. Does anyone here not know how to swaddle? Okay. And then I want to make sure I angle you guys where you can really see what I'm doing. So I don't know if it makes more sense just to do this on the floor. So this part, I don't know how I'm going to show you guys. Okay.
Jess, while you get that ready, I just wanted to say that I love that you had mentioned that by 8 weeks, we encourage parents to stop swaddling because babies get wiggly and want to move over on their stomach. And I just want to say it out loud that laying your baby down on their back to sleep is the safest way for them to be sleeping. Also on a firmer mattress in a crib or a bassinet or a co-sleeper, not with soft pillows or blankets or anything like that around them. It's important for the back to sleep campaign. You probably heard all about that. I'm sure your pediatricians tell you about that, but it's always worth mentioning when we talk about swaddling and baby sleeping, creating a safe environment without things around them, or soft mattress in bed with mom and dad. Things can go wrong that way. So co-sleepers, bassinets, cribs, lots of snuggles.
Yeah, so the ABCs of safe sleep are
Thank you, Jess.
alone, B, back, C, crib. I think that what I will stress with A, alone, is alone. There are safe ways to co-sleep. So if you are a family who's choosing to co-sleep, there are resources out there. You can safely do that. I think with my interpretation of A, alone, is no stuffed animals, no blankets, no pillows in the crib. Your baby doesn't need any of that. Even with like I think a muslin swaddle is good in the beginning, but the Velcro ones are great because you're not worrying about loose fabrics in the crib. So yeah, completely. The safest thing for a baby to sleep in is actually a box. And I think a lot of people don't know that. Like in other countries, there's this thing called the baby box. They actually do it here, just they don't ship it to Vermont or New Hampshire. I don't know why, but in other countries, they send you home with a box that has like a thin, firm mattress in it for a baby, and then everything you need for like the first 6 months of your baby's life, and you're just sent home with that from the hospital and you're good to go. But it's the safest thing because there's no dangers in this box. There's like nothing that the baby could get into and harm themselves with. And I think it's really interesting because we do have, like, I see a snoo in the background in someone's nursery, but there's like so many different sleep options. And I think like just remind people that, do what works for you, but like the very basic thing could be what works. So I don't know how well you can see this, but the way the baby is laid is where this is the triangle shape, like the point of the triangle is down at the bottom. So you would take their arm and hold their arm down and pull one side of your triangle over. With the muslin, you have a lot of fabric. So it's important to get it tight close to the baby, but you might have this kind of like loose dangly bit. And you tuck it in. Usually they will show you this at the hospital, at the birth center, or at home, wherever you're giving birth. But I think it's really important to get that first arm nice and tight down in there. And while you're holding this right here, I like to take this bottom part and pull it. I think that's the best way to get it nice and tight. You take the corner, goes up under here. You take their other arm, and then all you have left is the last corner, and you just go over, and your baby looks like this. I think that first tuck is the most important part. And the thing I've learned is if you hold it in place and pull that bottom bit, that's what really, really gets it. And then this you can either leave dangling or you can like tuck it in this bottom part here, but you got like your little burrito baby, and they're good to go. It's obviously easier to learn when you're like in person. I can show you and like give you each a doll to practice on. But again, if anyone like has any questions, you guys can always reach out, and I can try to get this set up a little bit better to show you on Thursday. The other thing I wanted to chat about today before we go is room sharing. So the AAP right now recommends room sharing for the first year. No one's going to tell you that. No pediatrician is going to tell you that. Not even if they follow the AAP to a T. I've never once heard a pediatrician recommend this to a family. The reason why is because it's also important that you get good sleep. So my take on it is the reason it's good to room share is because babies will sync their breathing to the person closest to them. So you are more likely to wake up if something disrupts your baby's breathing if you are in the same room as them and get to them before something happens. It reduces the risk of SIDS. A lot of people do not find it practical to share a room with their infant because babies make a lot of noise in their sleep. And it's not noises like they're waking up, but they're grunting and just letting out little sounds that make it really hard for, sorry, my puppy is whining. Ellie, come here. That make it really hard. Now I'm getting attacked by puppies. Make it really hard for them for the parents to sleep. And again, it's really important for you to sleep. If you're not sleeping and taking care of all your needs, how are you supposed to care for this other human being? And we're expected, like, no matter what member of the family you are, there's so many tasks that are put on you and so much support that you have to offer everyone in the family. Like, you need to give your other children attention. And hold on one second.
Puppy love. While she's taking a minute, I wanted to just quickly say that I love that we had talked about resources like the breastfeeding magnet. And I wanted to give a plug for parent-child centers. If you live in the state of Vermont, then there are 15 parent-child centers in the state of Vermont. So no matter where you are, there's one that you will be like assigned to, which would be your region. The Family Place is the parent-child center for Norwich, Hartford, Heartland, Woodstock, South Royalton area. And we give out welcome baby bags, and in those welcome baby bags are the breastfeeding magnets as well. So one of the things that I do as parent education coordinator at the Family Place is organize those welcome baby bags. So if you live in Vermont and you're having a baby, get a hold of me for a bag.
And I'm down in Springfield, and I don't know like all of the cities that we serve, but I know Springfield is closer to like the Swansea Birth Center. So if you're down this way, you can probably reach out to them. Yeah, my golden retriever really likes to antagonize my German Shepherd puppy, and they were just rolling around playing, but it's noisy.
You're gonna have to show us these puppies.
Oh my
at the
goodness.
end. You have a German Shepherd puppy? I need to see this. Okay.
She's crazy. She's currently chewing up something.
I see Marissa's puppy too.
Ignore.
Puppies and babies, you guys. Whew.
But yeah, so parents, you need good sleep in order to care for your family, to run your household. And I'm not saying that everything falls on you. Partners, it's really important to step up and like take over some of those tasks that that the birthing partner does during that postpartum period. But in order to get back to feeling more like yourself, I found so many families I've worked with like miss doing dishes, which sounds crazy. It's like, why would I ever miss doing dishes and laundry? But it's something that feels normal. And when you're in the trenches of postpartum, it can be nice just to feel back to normal a little bit. But to get there, you need good sleep and you need to be taken care of. So some families don't find it practical to room share, but it is recommended for the first year. I think that even if you don't plan to do it long-term, It can be good in the very beginning because you are getting up to feed your infant so often. Even if your infant is sleeping a lot during the day, they need to eat every 3 hours in the beginning, and then one like 4 hour stretch of sleep. Once they're up to their birth weight, which is usually around 2 weeks, 3 weeks, they can go longer stretches at night. The more your baby eats during the day, the less they need to eat at night. Some babies, stick with those nighttime feedings, and that's normal. But if they're getting all they need during the day, they usually can go a little bit longer at night. But in the beginning, when you're getting up every 3 hours, it's 3 hours from the start time of the feeding. So if you feed your baby at 8 p.m., you have to get up and feed your baby again at 11. So you might spend an hour trying to like get nursing down with your baby, and then change their diaper and get them swaddled again and get them settled back down. And then by the time all of that's done, you might only sleep for an hour and a half before they have to eat again. And at that point, it's like, do you really want to be constantly walking back and forth between like your bedroom and nursery? And she's jumping on the oven. I don't know what she thinks she's gonna like get over there, but there's no food. I don't know what she wants. But I think my recommendation as far as like that 2 hours of trying to get everything done before your baby goes down again, change their diaper when they first wake up. Don't change it at the end of the feeding. That feeding is going to get them back to sleep. And if you get them back to sleep and then change their diaper and wake them up, you have to start the whole like soothing process all over again. Change it right when they wake up. Or if you have a baby who is sleepy during feedings and falls asleep halfway through the feeding, change their diaper in the middle of the feeding. I worked with one baby who constantly fell asleep and after nursing on one side and didn't really want to nurse on the other side. And then he would wake up very shortly after needing to nurse. But he would always poop while being changed. So what we did is we would have him nurse on one side, and then I would go and change his diaper and then bring him back, and he would nurse on the other side. And that would wake him up just enough to get him to eat on the other side. And then he wasn't sleeping in a poopy diaper. But I think if you can get the diaper change down at the beginning or middle of the feeding, that's really great. The other thing with room sharing, so there's the syncing their breathing to you. There's also, they sync their sleep to you. So if you're a really good sleeper, your infant can sync up to you and is more likely to be a good sleeper. There isn't really any study about like how far away from the baby you can be. So like if you're on the opposite side of the wall and your baby's in the room next, like right next to yours, they're probably getting the same benefits because they're right there. So yeah, that's kind of my little spiel on room sharing. Again, you really have to like do what works for your family because it's important that you're taking care of yourself too. There are benefits to it, and it does work out really well for some families. I think that if you have a grunty baby, your body kind of trains itself to recognize what's just a grunty noise and what is like a I'm hungry, I'm waking up, I need something noise. It can take a little while, but I feel like I've been doing overnights for years and working pretty much 7 nights a week. So my body is like, okay, I got it down. But even when I work with a new baby, it takes a minute to like know what their noises are. With your infant, you'll pick up on like what cry is their sleepy cry, what cry is their hungry cry. Like they will start to sound different, but it can take a little bit to kind of pick up on there. It's like learning a new language. You have to learn your baby's language. So that, do what works for you as far as room sharing goes. But if you have a grunty baby and you really want to do it, you can try to power through. A lot of families I work with navigating infant sleep, sometimes they divide the night in half. So like one partner does one half the night, one does the other. Sometimes they divide nights of the week. So they like switch every other night, or they like set aside time. Whoever's doing the nights gets to sleep in on the weekends or like something like that. But when I do overnight care, a lot of the families I work with, they actually in the beginning sleep in separate rooms for the first few weeks postpartum, which at first, like I know for a lot of people that would sound kind of like not a great step in their relationship, but it worked really well because the mom was getting up to pump or breastfeed or do something frequently. And the dad was able to get a full night's sleep because she didn't need him. And it was established that like they both agreed that that's what worked for the family. And that she didn't need him in the same room. I think it creates a strain if your partner's like, well, I'm going to go sleep in the other room and you can like handle all this on your own. You know, like communication's key and discuss what works for your family. But it worked really great for a couple families I worked with, because then the dad woke up the next morning and was well rested and was like ready to go and make breakfast for everyone and get the other kids ready. And the mother could sleep in because dad was well rested and able to come in and take care of the baby. So I think that as far as like sleep goes and like with your family, there is no textbook answer of what's going to work. And it's just communication and all of that. But on Thursday, I'm going to go into like wake windows and all my tips for like getting your baby to sleep well, because knock on wood, all the babies I work with have started sleeping through the night at 10 weeks completely on their own. So I think it's possible and that you can have good sleep.
One of the, so this is my second, but with my first, I joked, I had both my boys have been very loud sleepers, very grunty, very gassy babies, constantly making noise. And when we switched our oldest to a pack and play in our room out of the bassinet, I would joke and say it was like listening to someone sleep in their wind pants, because he was constantly moving. So you heard that like noise, like if you're wearing wind pants. But my husband and I used to joke and say that we didn't have to sleep train our son. We had to sleep train ourselves, because we had to teach ourselves that it was okay that we didn't have to get up at every single grunt or noise. Like I immediately thought that anytime he made a noise, I had to get up and feed him, but that wasn't the case. So I had to like train myself that it was okay to let him, he will tell me when he's hungry, and him grunting is not necessarily him telling me he's hungry. You learn their sleep cue, their hunger cues and their language, like Jess was saying. One of the things that we found that worked really well for our family in regards to sleeping is the baby sleeps on my husband's side of the bed. So the bassinet is on my husband's side of the bed. I'm breastfeeding. So when the baby wakes up to feed, my husband gets the baby, hands the baby to me. I feed. My husband does the diaper change, hands him back to me, and then I put him back in the bassinet after his feeding is over. So we're both getting up, but we both have different jobs and we know what our jobs are. That way the responsibility isn't all falling on one person, we're splitting it. And it's just another one of the things that it works for us. It might not work for other families, but that's what we found that works for us. And we all get sleep, same sleep. One partner doesn't get more sleep than the other. So we're not, nagging each other, well, you got extra hour of sleep and I didn't type thing. It's just what works for us, but wanted to throw that out there as another option for folks. My husband doesn't mind getting up in the middle of the night to do the diaper and handing the baby over. He knows that breastfeeding is hard and takes a toll on the mom's body. So anything that he can do to step in and help. And he also uses it as a bonding time too, to do the diaper.
I think, so what you said, and then what Emma just said about the pause, this is what I was going to touch on a bit tomorrow, but it makes sense to just say now. So in France, there's a term that translates to the pause. It's a French saying, I can't say it, but it translates to the pause. And it's basically like, if you're hanging out in your living room, doing your thing, your baby's in the nursery or somewhere else in the house sleeping, and you hear a noise, don't immediately go run in that room and pick that baby up. Just wait a second and listen and see. I've worked with so many babies where I hear them like let out a noise where I'm like, oh my goodness, she's awake. She sounds hysterical. Like she's probably starving. Like she slept such a long stretch. Oh my goodness, I need to get to her right away. And then as soon as I get to the nursery, I walk in and the baby's like passed out. And I'm like, it happens so many times where I'm like convinced they are wide awake. They made the loudest noise ever. Like they are definitely ready to get a diaper change and eat. And then you go in and they're still sleeping. So, check the monitor, see if they're wiggling around. But even if they are, give them a minute. Babies' sleep cycles are only 45 minutes long. Adults are an hour and a half. Transitioning from one sleep cycle to the next is tough for a baby. they don't produce melatonin until they're 4 months old. They can't regulate their sleep actually until they're 4 months old. They get melatonin through breast milk, and there's things that we do that I'll go over to Thursday to help encourage them to sleep better at night. But yeah, it's tough in the beginning, and they're noisy, and just take that little pause.
I love that. I love that advice. I think that's great advice. That goes beyond just newborn, practicing the pause. That's great. I want to thank everybody for being here tonight. And I want to encourage you that if you have some questions, or if we end our Zoom and you think, oh, I wish I had asked this, I want you to either write it down for Thursday, or, oh my gosh, look at that puppy. Look at that puppy. Look at it. Look at her ears. Oh my gosh. You can write it down, or you can also email me with the question, and I'll save it, and I will make sure that we get to it on Thursday. What's her name, Jess?
Ellie, Elowin.
Oh, Ellie. Yeah, so cute. I also saw Kathleen's cute dog snuggling. So sweet.
Babies tonight.
Babies and dogs together. We can talk a little bit about that on Thursday, but it's just so
oh yeah,
sweet.
if anyone needs advice on that transition.
I think that's a good idea. I was watching Marissa's super sweet big baby there, cuddling her this entire time. So,
but yeah, if you guys have questions and you want me to go over them on Thursday, feel free to send them to either of us. If there's something on Thursday that you think of, my plan is Thursdays, there's less to go over. And I want to do like a Q&A where anyone can ask what they need to, and more people can kind of jump on and share tips, whether you have a baby like Hillary and have tips to share, or maybe you just have a tip from like a friend that you've heard. But we can all kind of like chat a little bit more. And if you have questions in the future, I'm like a big believer in just like shoot me an email and ask whatever you want. I don't think you need to like hire me as your doula for me to like come in and answer a few questions you have. Like, I'm a big believer that I'm part of your guys' village. Like, this is our community and I'm a member of it. And you're welcome to reach out anytime.
I'm trying to write in the chat, but I'm just going to say it out loud that Kayla had asked about emailing the video recording because she had to come in late. And fingers crossed with my tech skills, we can make that happen.
The other thing, so I'm just going to post this link in the chat so you guys can all access my guide, but there
Awesome.
on my website, I'm going to post this link, but on my like what do I offer page, if you scroll down, it's like the first thing on there. There's a resource packet for the Upper Valley that has and some of the things are outside of the Upper Valley. So like, even if you're not in the Upper Valley, feel free to look at it. But it's like, toddler classes, parent and me classes, breastfeeding support, like anything you could need, story time, music groups, like any activity or something you could be thinking of, chiropractors, like all of that is in there. There's a resource guide it's like 40 pages long of like your healing postpartum, your healing if you have a C-section, caring for your newborn, what to expect, all of that. And then there's another one on pregnancy and infant loss and navigating that, because that's something I've personally been through. And if you are going through a pregnancy after a loss, there's some supports in there.
Great.
So those are all right at this link if you guys want to access any of them.
Awesome.
And at the end of the
thank you, Hillary.
At the end of the postpartum guide, there's a list. I have like 40 baby carriers and I do a lending library. So on Thursday, we'll go over baby wearing, but I'll say now, if there's a carrier you guys want to try out beforehand, you can borrow it from me, try it out with your baby, or try it out just like with a doll to get a fitting beforehand and just see if you like it. Because I'm a big believer in baby wearing, but it can be expensive to buy and then not use. So I'm a believer in trying before you buy.
Great.
Jess, could you, and maybe you are planning on talking about this on Thursday, not really necessarily baby wearing, but some of the wraps can be used as belly support. I found that super helpful when I was very pregnant. You need a little back relief.
I'll plan to go over that too. There is another wrap that I have. It's called a rebozo wrap. It's Mexican type of wrap. It means shawl. They kind of use it in Mexico. It's used for multiple uses, but I'll go over that on Thursday. It can be used for baby wearing. It's not my favorite carrier, but it can also be used in labor for belly support and postpartum. So there's a lot of like things like that that have multiple uses. And I think I'm a big fan of things that have multiple uses, especially when you're putting baby items. I swear it's one of like those companies are able to like make so much money because when you're in the trenches of postpartum and you find a tool that's like going to help with something, you're so quick to just like order it on Amazon. So yeah, I think like with baby carriers, I mean, baby carriers can be anywhere from like $30 to like $200. So it's good to try them out and see. There's a lot of options. Yeah.
Awesome. All right. Well, we will see you guys on Thursday. This was a lot of fun. And Jess, thank you so much for a plethora of wonderful information.
I hope it was overwhelming. I hope that you all were able to like
soak it in.
Yeah.
Awesome. All right, you guys. Well, I hope you have a great night. And we'll see you on Thursday. This link that I sent you through email is also good for Thursday. I will resend it on Thursday, but if you are wondering or you want to just flag this email, it will work on Thursday as well.
Thank you. And Tia, I'm not going to be able to make it on Thursday, so if you can record again, that would be super, super excellent.
Will do, Megan.
Thank you.
Hi, it was good meeting you all.
Thank you.